DynamiCare digital care program reinforces a person's recovery from addiction by offering easy-to-use technology, including random breath and saliva tests confirmed by selfie video, verified treatment attendance check-ins, supportive recovery coaching, and rewards for healthy progress with money deposited on a smart debit card that blocks cash withdrawals and spending at bars and liquor stores. If we're ready to go, DynamiCare Health, the floor is yours.
Thank you, Ken, for that intro. And you got a lot of the pitch done for me already, so we're off to a good start. I'm Eric Gastron. I'm the co-founder and CEO of DynamiCare Health. We are a digital care program for addiction. My friend Anna is in recovery from an opioid use disorder, but her situation got so bad at one point that she was totally dependent on support from her family, but they had lost trust in her. So she had to do urine tests in the bathroom at home with the door open and her dad standing outside. I thought there has to be a better way to support people in recovery. So I spoke to my father, who's an expert in addiction psychiatry, and together we came up with the idea of taking the best practices, evidence-based practices in the addiction research literature that promote motivation and accountability and transforming them into a technology platform that would help millions of people recover from addiction. We've received great traction working with health systems across the country and payers, including Aetna, Horizon Blue Cross Blue Shield New Jersey, and Anthem, which recently awarded us the Platinum Award in their Digital Health Accelerator. We have got great recognition, 3 grants from the National Institutes of Health, a $1 million prize from the state of Ohio, and we've been recognized twice by the New York Times, including this week, I'm very excited to say, highlighting our methodology, our story, and one of our members. DynamiCare works across substances, and we're not a treatment program. We're a digital care program, so we can be complementary to outpatient care. We can be a continuing care program when people are discharged from inpatient rehab, and we can be a standalone program, for example, as an employee benefit. We sell to health plans, employers, ACOs, and government agencies to improve outcomes and reduce costs. And we do that through our technology platform, which combines supportive recovery coaching from coaches who are in recovery themselves, remote substance testing through the app. So you see my webcam, we have breath and saliva tests that our members do over selfie video, breathing into the breathalyzer, performing a saliva test, so we know when our members are staying sober. We have appointment tracking using GPS in the app to know when people are going to their doctor's appointments, therapy sessions. We have self-guided therapy content, and we tie everything together with motivational incentives on a smart debit card to reward people for staying sober and doing the right thing. We've demonstrated our validity in 3 clinical studies across drugs, alcohol, and tobacco with academic research partners, showing 2 to 3x improvements in quit rates. Our business model is to charge a monthly bundled case rate for our program, $290 a month for the drug and alcohol coaching program. We have over 50% gross margin. And on top of that, we charge for the financial incentives, usually up to $100 a month, up to 6 months per member over the course of a 12-month program.
All right, Eric, you've reached the 3-minute mark.
Take your questions.
All right, just a reminder to our judges, if you could raise your hand over in the participant section, I'll be happy to call on you, but the floor is open for us to do questions for Eric. And Josh, I believe you have the first question.
Yeah, thank you, Ken. Eric, great. Really appreciate your presentation. Maybe what I'd love to learn is just a little bit more about your journey. Like, what lessons have you learned? What adjustments have you made throughout the process to kind of prove your entrepreneur ability to kind of just break through any wall that's presented in front of you?
Sure, I could probably talk all day about that. I think one of the really interesting things for us on this journey has been starting out the company as a tech platform and then evolving into services as we saw members who were using the app as part of their treatment program would drop out of treatment, but then continue using the app because there's very high dropout rates from treatment. And so we would have members who continued to do the breathalyzer test, even if they would test positive, with no clinician on the other side. And that's why we built out our recovery coaching program, which has really improved and transformed our outcomes and ability to implement, especially with payers.
Amy, I believe you have the next question.
Yes, thanks, Ken. Great presentation, Eric. Really good job.
Thank you.
One, you just mentioned dropout rates in general programs. I'm interested in your member retention and just the life of a membership in your program. And then two, competition. Just interested in what you view as your competitors and how you do that.
Sure. So we actually have seen that our retention rates are higher than the in-person treatment programs that we work with. People will drop out of treatment but then continue using the DynamiCare app. We're at about 65% retention in month 4, which is very good for addiction treatment. And in terms of the competitive matrix, I have a slide on that. We're squarely in the digital health bucket, and I think we're the leader in that category given our traction with both the payers and also research. We're different than the telehealth, which is a separate bucket of doing standard practice addiction treatment, but then doing it over phone or Zoom. We're really reinventing things from the ground up using evidence-based practices through technology, and that's what sets us apart.
Great, thank you, Eric. Larry, I believe you have the next question.
Yeah, no, I wanted to ask you were getting into it some, but your revenue model, your business model, it seemed to be to contract with the payers. How do you demonstrate the value to the payer, or what is sort of your ROI for the payer in terms of entering into a contract with you?
Great. So the solution, including the incentives, costs around $350 a month. Compare that to over $1,300 per member per month in excess costs for the average member with a drug or alcohol addiction. And most of that is driven by the medical spend, hospitalizations, readmissions. So what we do is we demonstrate our ability to improve the clinical outcomes first, as the initial endpoint, and then look at the claims data readmission rates to prove out the ROI. Our models show we can actually drive ROI within the first year because incentives are able to change behavior so quickly.
Great job, Eric. And I know that I'm sure there are other questions, but we're going to need to go ahead and move on to our next pitcher.
Thanks, everyone.
Great job. Thank you, Eric.